Thank you to the board of the Indian Association of CBT, especially Dr. Nimisha Kumar, the president of ICCBI, for inviting me to give this keynote presentation today. For allowing me to work with you to help found this beautiful organization, and for giving me the title of Honorary President of ICCBI. Out of all the titles and affiliations I hold or have held, nothing makes me prouder than to be given the title of Honorary President of ICCBI. For those of you listening, I hope that you will consider joining this wonderful organization that is disseminating CBT all over India. आज मुझे दावत देने के लिए धन्यवाद। मैं भारत की निवासी हूँ। मेरा जन्म बम्बई में हुआ था और वहाँ मैं 21 साल तक बड़ी हुई यूएस आने के पहले। As an Indian American now, आज आपसे बात करने से बहुत खुशी हुई और मैं सभी को दीपावली और नए साल की शुभकामना देना चाहती हूँ। So let me begin with the presentation. The title of the presentation is Grappling with the Crippling Rise in Youth Anxiety in the Wake of the COVID-19 Pandemic. My name is Lata McGinn. My maiden name was Keswani. I am a co-founder of Cognitive and Behavioral Consultants, which is a clinical and training center in New York City with locations in Manhattan and White Plains, New York. I'm also a tenured professor of psychology at the Furkat Graduate School of Psychology at Yeshiva University. I'm also on the board of directors of the World Confederation of CBT, a global organization tasked with disseminating CBT all over the world. This is an organization that I helped found in 2019. And I'm delighted to say that the Indian Association is represented on the World Confederation through the Asian Association of CBT. And your very own Dr. Nimisha Kumar is currently on the board. So I'm delighted to continue working with her and to continue working with ICCBI. So let me start by describing the scope of the problem that we face today. There's a mental health tsunami in the wake of the pandemic. An article published in Lancet in 2021 basically showed that rates of depression and anxiety have climbed globally by more than 25%. It's a devastating ripple effect of the pandemic that has particularly affected women and young people. Surveys show that beyond women and young people, caregivers, so first responders, healthcare professionals, mental health care professionals, school personnel, parents, especially of young children, have also been affected. A coalition of the nation's leading experts in pediatric health have issued an urgent warning that declaring that the health crisis among children is so dire that it has become a global emergency. So what are we looking at? Of course, anxiety, sadness, trauma, loneliness. And what they're experiencing is really welling over into the classrooms. So what teachers are seeing is younger kids there's increased crying, disruptive behaviors for older adolescents, it's bullying and violence. And for many other children who keep their anxiety and sadness inside, the pressures of school may be feeling too great at present, so leading to school refusal to participate in school. Teenage girls have emerged particularly at risk. So this mental health tsunami, particularly among youth, is caused by many factors. So let's take a look at what those factors are. First, there's the threat of COVID itself. So not only fears of getting COVID or fear of loved ones getting COVID, in fact, having losses associated with COVID. So a recent article in the Journal of Pediatrics showed that 140,000 children just in the United States alone have lost a parent or grandparent or a caregiver to COVID. And a majority of these children in the United States were the children who were non-Caucasian. In addition to that, what we know is that this threat has become persistent. So our prehistoric brains are equipped for acute catastrophes. So COVID has been going on now for a year and a half. They're simply not built for this relentless, persistent threat we have been experiencing this year. Our emotions, thoughts, and behaviors are being triggered 24/7, way beyond the purpose they were evolved for. There's an education disruption. There's a loss of learning for kids. This is more than a summer slide. The disruption to education experienced by young people across the globe is estimated to be the largest in history by the UNESCO. 1.6 billion children were left out of school. Correspondingly, there has been a life skills disruption that has led to skills deficits, basic civics, social skills, performance skills, which is further affecting their ability to learn. So if you almost think about it, that their social or civic muscle has eroded, kids behave differently at home than they do at school. And after a year of being home, the difference between school and home has eroded. And they may be behaving at school as they did at home, or worse, given the rates of anxiety and depression. So after a year of isolation, coming back to socialize and facing performance pressures may make them crippled with anxiety or sadness. Being unable to avoid situations that make them anxious could lead to violence. Now, moving on to the fourth box, they've also been experiencing stress before COVID. So what is the pre-existing stress? Now, anxiety is often considered the invisible condition. Symptoms are minimized or ignored. It's mistaken for other conditions. In the past 10 years, there's been an increasing, both a recognition of anxiety and an awareness that it is actually increasing. Rates of moderate to severe anxiety have jumped in the last 5 years from about 18% to about 35%. And we want to know what's going on. So what is going on? Let's take a step back and look and see what happened before COVID came into our lives. Our lives have been transformed in the 21st century, especially in the last 10, 15 years. Adults and youth have been leading extraordinarily fast-paced lives at home, school, at work. Our youth and educators have been facing immense academic pressures. Our schools and communities are doing worse as a result with stress. In addition, our communities also have far less social support than ever before. In India, we've always had joint family systems traditionally, and those began eroding and more nuclear families began several years ago. However, the last 10, 15 years, there's also been more migration, people living far away from home, lots of people immigrating to different parts of the country, to different parts of the world, parents, staying back. So there's been far less social support than ever before, which is also creating and making people vulnerable to stress. In addition, the digital age that we live in has been responsible for a large part of this transformation. We are inundated 24/7 with news media, social media, that basically fuels our perception of danger. It fuels our social comparison. It leads to social contagion. And the pace of our world has been hurtling at a speed that is really hard for our prehistoric brains and bodies to keep up with. In addition, we now know that children experience adverse experiences far more commonly than we realized, and that these adverse experiences have an impact on their mental health. Interpersonal conflict, school pressures, health issues, family challenges, moves, other transitions, divorce, poor academic performance. And then there are adverse childhood experiences that rise to the level of a trauma. The term trauma has been applied in our everyday language by so many contexts, by so many people, that it has lost some of its original meaning. So trauma is an exposure to actual or threatened death, or serious injury or sexual violence, either by directly experiencing it, witnessing it in others, learning that the traumatic event has occurred to a close family or friend, or in the case of first responders, being exposed to aversive details of the traumatic event. Now, we know that traumatic events are fairly common in children and adolescents. And of course, coming full circle, now we have the COVID-19 pandemic. So once again, our prehistoric brains are equipped for acute catastrophes. They are not equipped for the relentless, persistent stress that we have been experiencing for a while, and especially in the last year and a half. So why does it matter? Well, anxiety is common, it is universal, and it is as universal as medical problems or pain, physical pain. It's fundamental to human experience. According to the latest estimates, more than 1 in 7 adolescents across the globe is diagnosed with a mental disorder. Anxiety statistics worldwide show that they are pretty common across the globe. About almost 4% of the globe suffers from anxiety disorders. That figure is much more common among women, almost 5%, and about 2.6% for males. Meanwhile, there's a gap between how much anxiety there is or how much mental health needs we have and mental health funding. So this report also finds that about 2% of government health budgets are allocated to mental health spending globally, which is just a shame. So we know that not only is it common, but the impact on functioning is very significant. Some stable folks take adverse experiences in their stride, like COVID, and others will need more care. Some will need only a little bit of support, and some who did not have any mental illnesses will become catapulted into mental illnesses. And those who were previously suffering from mental illnesses will just get their symptoms and conditions worsened during the pandemic. We also know that this COVID-19, this disruption caused by it, is occurring for youth at a developmentally very critical period for them. So the impact can be long-term, okay? And we know that anxiety can lead to substance use, performance issues like poor concentration, attention, memory, decision-making, ability to solve problems, irritability, muscle tension, decreased sleep. It can also worsen other problems, such as leading to poor self-esteem, poor social relationships. They have difficulty maintaining social relationships, and also leads to school avoidance, refusal of school. And so we know that untreated anxiety is costly for the individual. It's also costly for caregivers and for schools and for society. At this point, CBC, which is the Clinical and Training Center that I founded, is in about 100 schools training mental health professionals. So the cost of untreated anxiety is really $72 billion in the United States alone. But we know that if you look at it globally, the lost productivity as a result of the two of the most common mental illnesses, anxiety and depression, costs the global economy a staggering $1 trillion a year. The new study by the London School of Economics also showed that the lost contribution to economies due to mental disorders that lead to disability or death among young people is estimated to be about $380 billion a year. So the rest of the talk will be divided into 3 sections. What do we do, given why it matters, is to learn about anxiety and to help our clients and teachers and parents learn about anxiety, and to learn about avoidance, which is common when people are anxious, and to transform them into approach. So let's start with anxiety. What is anxiety? When and how does it become a problem? What are the types of anxiety problems? Who suffers from anxiety? And why do some people suffer more than others? So we know that anxiety is normal. Anxiety is an emotion. Emotions are inbuilt alarms that we have to help us survive, to warn us that we need to do something to survive. Anxiety itself is an alarm for imminent danger. It warns us that imminent danger is about to occur and helps us get out of danger by motivating us to act, by propelling us towards acting. So through a series of neurochemical reactions, our brains give us anxiety, and that helps us flee, fight, maybe freeze, or faint. And all of those reactions, particularly fight and flight, are the most common. And we know, for example, when COVID-19 was something far away in a different country, we didn't worry about it so much. As soon as it hit our own communities, we began washing our hands and began taking precautions like wearing masks and isolating. So that is adaptive. That is us fleeing from danger. So when does anxiety become problematic? When there's a high level of danger, like COVID-19, especially when it becomes persistent. Some people have false anxiety alarms. There's no danger, but the anxiety is out of proportion to the danger. Also, in many cases, anxiety may be obsolete for the kinds of dangers we face today. So it may be unhelpful. For example, if you face social or performance pressures, that can actually lead your anxiety. So if you turn your attention to the slide on the graph on the right, what it shows you is the Yerkes-Dodson law. And what that shows is that you need a little bit of anxiety to perform well. But if that goes up beyond a certain point, beyond that optimal level, your performance starts to decline. So attention, memory, decision-making, all of those things get impaired. So what are the types of anxiety disorders that you see in youth? You see specific phobia, general anxiety, social anxiety, just like you see in adults. You see obsessive compulsive and related disorders and PTSD, which are now no longer officially in the anxiety disorders category, but are anxiety disorders nonetheless. And of course, panic disorder. The two disorders that you see commonly in youth that you rarely see in adults is separation anxiety disorder and selective mutism. So some quick facts beyond anxiety disorders being widespread. They basically have a lot of comorbidity. If you have anxiety, you also may suffer from another anxiety disorder or depression. We know that the onset can be acute or gradual depending on the type. For example, panic disorder is fairly acute. General anxiety is fairly gradual. All anxiety disorders, including OCD, PTSD, and so on, are chronic stress-sensitive problems. They're not bacterial infections. They're like the equivalent of medical, sort of chronic medical diseases. So they're not like an infection that you can cure, like a bacterial infection. Mental illnesses like anxiety and depression are essentially like the equivalent would be chronic medical conditions like asthma or diabetes, where they're chronic, they're stress sensitive, and they wax and wane throughout a person's lifetime. They're typically more common in women, but it varies. The onset also is either usually in childhood or early adulthood, depending on the anxiety disorder. And we already talked about how it significantly impairs functioning. So collectively, anxiety disorders are the most common disorders in the United States. And if you look at the world, up to 11% of the population worldwide suffers from at least one anxiety disorder in their lifetime. We know that things put risk, so create risk. So if you look at predisposing factors, what makes people vulnerable to developing anxiety? Evolutionary factors, genes, temperament, neurobiological factors, environmental factors that we discussed today at length, including the family environment, parenting styles, peer interactions, negative life experiences like COVID all play a role. And then we move on to precipitating factors, like why does it start? And that's stressful life events. Something happens that's stressful to the individual, and that sets off the chain. And then there are perpetuating factors, which we'll talk about, cognitive and behavioral factors, and of course, continued stress. So now let's talk about avoidance. What happens when anxiety problems are untreated? Avoidance becomes a very big issue. So we know that the way that you think and behave can put you at risk for becoming anxious. Negative thinking styles can lead to anxiety and avoidance, and a variety of behaviors such as avoidance, escape, passivity can make people vulnerable to becoming anxious, and they can also help maintain. So not facing fears leads to problems. So you take a look at the girl here in this example. She had a fear that she was going to fail this exam. That led to anxiety, which then led to her getting up and watching TV and procrastinating. Now, this was something she did very commonly. So this would then, in the minute when she did it, when she moved away from studying and got up and watched TV, it produced immense relief. This relief in behavioral theory we call a negative reinforcement. What that means is that because of that relief is so powerful, it actually winds up increasing avoidance in the future. So not only does the avoidant behavior increase, the anxiety increases. And then her fear that she's going to fail continues as well. So cognitive misappraisals continue. And over time, if this pattern continues, she starts to think of herself as a failure. We also know that the environment responds to people with anxiety often in a way that also inadvertently maintains the anxiety. So often we engage in crisis-oriented responding and accommodate to the anxiety. Accommodation occurs when you give in to a child's anxiety rather than letting the child tolerate some discomfort and learning how to cope. So you might give them increased attention, what's going on, talk to me. You might remove demands because they're anxious. You might say, okay, fine, you can give it to me tomorrow, no problem. You might jump in with problem solving as well. You might say, try this, why don't you try that? Why don't you do this? You also may provide reassurance. You might say, oh, you'll be fine. Don't worry about it. It will be okay. Parents might get involved, right? They might pick up early. They might excuse lateness. They might email the teachers, ask for extensions. They might interfere in peer conflicts. They might alter their own personal routines. And for us as therapists, we might change the schedule, but when we see students, we might give them extra attention. If they come to see us, change their schedules and so on. So there's many things that can inadvertently increase anxiety. And we call this accommodation and these are safety behaviors that children engage in. So what that does over time is that it leads to less time spent in the classroom learning. It leads to school avoidance. It leads to difficulty coping with stress, difficulty coping with feedback, and difficulty problem solving independently. So how do we transform this into approach? The irony of anxiety is that it's highly treatable, yet only 20 to 30% of those suffering receive treatment. So how are anxiety disorders treated? Essentially using CBT. So CBT is a subjective form of psychotherapy that treats psychological problems like anxiety by modifying dysfunctional thinking, feelings, and behaviors. And this focused form of psychotherapy is targeted towards these three elements. And numerous studies showed that it's extremely effective for anxiety and related disorder. So what is the CBT toolkit for anxiety? Essentially, we begin with an idiographic case conceptualization, which means that you trace out in the moment for a client what is going on. You look at the exact situation that triggers anxiety. You look at their thoughts, you look at their emotions, you look at their behaviors, physical reactions, and you do this over and over again. We call these chain analyses. We also use automatic thought logs. And basically using multiple patterns of these, we come up with a roadmap, a case conceptualization that allows us to understand what is really going on with this client. And based on that, we then develop a targeted treatment plan. Psychoeducation is a core component of it, cognitive restructuring, exposure and response prevention, skills training, and behavioral modification. So essentially you are retraining their brain not to see danger, both by changing their thoughts and changing their behaviors. So what results does CBT achieve? It improves symptoms and problems, better functioning and ability to cope. It improves communication, functioning with others, and it allows people to reach a better quality of life and to reach their true potential. Very quickly before we end, we teach approach skills by helping to have them accept, recharge, and confront. So accept is really, think of the Yerkes-Dodson law. Imagine if you were sitting next to a fire alarm going off in your ear, it would be hard to focus. So the first part of the treatment is empathizing and validating the anxiety. And that means that you're also understanding and empathizing with the specific triggers and helping to really understand what brought it on. If you thought that you were going to be failing an exam, you would be pretty anxious too. So I think that's trying to understand what is going on in the youth's mind and what they're afraid of and why are they behaving that way. So helping to really validate the situation, helping to validate the feelings, and helping to understand their feelings based on their thoughts. You're not trying to excuse the behavior, you're just trying to understand the behavior. Then you move on to recharge. And that means if they're overwhelmed by anxiety, we help them manage these anxiety symptoms. So one goal would be, if they're very overwhelmed and they're out of control, to help them get through that tough situation without making it worse and without their emotions getting in the way. We call these grounding techniques in CBT. It's a short-term skill that decreases the intensity of the emotion. It doesn't change the emotion. It's a Band-Aid skill. We also teach a lot of wellness exercises that are not just Band-Aid, that are used to create overall wellness. Basically breathing exercises, progressive muscle relaxation exercises. And then the final is, of course, the confront skills. So that is to change their, not only their thoughts, but change their behaviors. You're helping them change the thoughts. You're helping them change their behaviors. They're changing their approach to anxious behaviors. They don't need to, in a sense, what they're learning to do is, despite the anxiety, changing their thoughts, despite the anxiety, changing their behaviors, accepting discomfort and confronting fear. So in a very systematic way, we keep the long-term goals in mind to help them confront the very things that they are afraid of, with a goal of not leading to that negative reinforcement cycle and allowing anxiety to be there, to tolerate it, because we know that anxiety is not dangerous. We know that it's unpleasant. It's just an alarm. So the goal is to help children and adolescents tolerate anxiety, cope with it, and continue to approach the things that are helpful to them. So that brings us to the end of the talk, and I am delighted to have been invited to be here, and I hope that you will enjoy the rest of your conference.